eBay. He also happens to be a self-taught illustrator. And Dominique, if you don't mind sharing some of Mr. eBay's work. His passion for health equity led him to create medical illustrations in darker skin tones. And in doing so, his illustrations have sparked conversations about skin tone underrepresentation and the impact that can have. While Mr. eBay is not the only medical illustrator working to normalize use of diverse skin tones in medical textbooks and periodicals, it is definitely something that we today can embrace because of its relevance to the topic. And I'd like to now talk about how we pay honor to the intersection of Black History Month and Black maternal health. We've partnered with members of the birth worker community to host today's Black Maternal Health Roundtable and to discuss the associated health crisis impacting Black women in the United States and Nevada. To prepare for what is sure to be a robust conversation, allow me to share a few statistics, such as the United States has the highest maternal mortality rate of countries with technologically advanced healthcare systems, or that in 2018, the United States recorded 17 maternal deaths per 100,000 live births, and that Black women are 2 to 3 times more likely to die from pregnancy-related causes than white, Hispanic, and Asian Pacific Islander women. In 2020, Nevada's Black non-Hispanic women had the highest pregnancies associated with live births, and that was a ratio of 181.7 to 100,000 live births. And 24% of the pregnancy-associated deaths were attributed to this population. And lastly, from all the Nevada live births in 2020, Black non-Hispanic women were only making up 15% of those live births. So our moderators today know these statistics better than most, and they are 2 incredibly advocates from the Nevada birth worker community. Rikki Jenkins and Tiara Flynn, who in their own way honor the legacy of Black healthcare professionals. And I'd like to turn it over to Rikki right now.
Good afternoon, everyone. Thank you so much for joining us. Thank you, Carlos, Dominique, Tina, and the Nevada Office of Minority Health and Equity for hosting today. My name is Rikki Jenkins, she, her pronouns, and I'm so excited to be moderating today's conversation. I'm a doula, childbirth educator, certified lactation counselor, and evidence-based birth instructor. I'm also the co-creator of Heart and Soul Collective, which is a community-led space for new and expected families. Here alongside me to moderate today is Tiara Flynn.
Thank you, Rikki. Excuse me. Good afternoon, everyone. And again, I want to thank you all for joining us. Much appreciation to Carlos, Dominique, Tina, and the Nevada Office of Minority Health and Equity for your leadership and partnership with today's event. My name is Tiara Flynn, and I am someone who's new to the birth community. I'm very honored to be here alongside Rikki, who's very much respected in the birth community. We're here to moderate this very important discussion together. I'm also a birth doula. I'm on the journey to many certifications. I'm also an Air Force veteran, and I'm a small business owner who's been serving in Southern Nevada for the past 9 years. From the statistics that Tina shared, and in recognition of Black History Month, and the importance of culturally responsive care, myself, Rikki, along with Tina and her team, wanted to invite you all to join us for this very important conversation. So before we jump into that discussion, we wanted to cover some Zoom housekeeping rules. So to ensure that we have enough time from all of our panelists, all attendees will be muted and off camera if you so choose. Please utilize the chat and questions for commentary throughout the entire discussion. We do have personnel that are managing the chat, and we will address them during the Q&A portion.
All right, so let's talk about why we're having this conversation. We know that most pregnancy-related deaths are preventable. We also know that racial disparities exist, and many factors contribute to such disparities, like quality healthcare, structural racism, and implicit bias. As birth workers, advocates, and maternal public health professionals, we want to work together, and we absolutely should be working together to reduce Black maternal mortality and reduce factors that contribute to pregnancy-related complications and death. Birth workers want to provide quality and affordable care for their clients to overcome these challenges. To accomplish this, as a community, we offer a variety of services and resources that includes prenatal care, postpartum care, advocacy, and collaborative efforts. We have a few panelists with us today to discuss each of these pillars and resources. So first, we're going to talk to Jacinta Wood. Jacinta Wood, pronouns they, she, is a student midwife and full spectrum doula. They offer accessible evidence-based birth, postpartum, and reproductive services. Her goal is to help birthing folks and their families honor their gestational year by centering growth, expansion, and a connection to African American traditions. Thank you so much for being here with us today, Jacinta.
Thank you, Rikki. And Tiara and everyone hosting this. So like Rikki said, I am a birth doula and a student midwife. I got into this work because of my own birth experience and the lack of information that was given to me. Pretty much like the OBs just decided what was going to happen in my birth. And after having said birth experience, I realized that that's not how it should be. And I should have had a lot more say. So that really inspired me. And also just having the lack of like information and knowledge in my family and in the people that surrounded me for support, I didn't have that either. So my goal is to kind of be that person for our Black mothers, our Brown mothers, our Indigenous mothers, like people really, because pronouns and gender and all that stuff also, right? But just to be that supportive person when they don't really feel like they have that in their circle, and to dispel like you can have a say, like you don't have to just go with what your OB says. You can actually ask questions, and teaching families how to ask questions and how to ask their providers the open-ended question to get them to really sit and take a moment to spend time with them and show them like, this is why we're doing what we're doing. This is why we're testing what we're testing. Yeah.
Thank you, Jacinta. Personally, I'm so excited to have another Black midwife, especially here in Vegas. I think it's really important that birthing families, sees someone and receives care from someone who looks like them, of course. So my question to you today is there specific advice that you give prenatally to clients that you feel is usually missed during their care? I know you just touched upon this. And have you found that, this information interferes, or does it help with their care?
So the first one is, like I said, showing them how to ask questions with their providers, right? Like if the provider says, let's do this test, and they're like, I don't fully understand, go back and ask them why. But then the second one is understanding that in the hospital system, as unfortunate as it is, like they have their protocols. They're going to find the reason to do what they want to do. So what can you actually have control over, and being realistic? And I think that helps a lot of people dispel the like, what is told to people on social media and what is like, this is your hope, this is your dream, butterflies and rainbows. Like I like to just have people be honest about situations and possibilities. And I think that helps people feel more empowered. So.
Absolutely. Thank you so much for sharing that with us.
You're welcome.
So next up, I want to introduce another one of our doulas that is in the birth community. That's going to be Jordan Solo. She, her pronouns. She's a mama, birth and postpartum doula, childbirth educator, and prenatal and children's yoga instructor. Thank you so much for being here, Jordan.
Yeah, thank you, Rikki. It's an honor to be here with all of you guys. So basically, I originally started my business, as most of us, I feel like, after I experienced my own birth trauma and postpartum. I suffered from postpartum depression and anxiety. Afterwards, I I mean, not in the moment, but afterwards I noticed just a lack of support I had all around in every aspect, and that greatly impacted how much I was suffering. So as a more recent entrepreneur in the birthing community, I've been able to gain more insight on how these disparities impact the community. I've learned one of the biggest reasons this happens is because many expectant mothers and families don't even know, like myself, that these local and online birth communities and resources are available to them. As a birth and postpartum doula and in my childbirth education courses especially, I emphasize postpartum care and preparedness, and we walk through each step on how to prepare, what it looks like, and how to combat it as a family. Many of the postpartum complications and even deaths that occur are most likely preventable, and the disproportionate impact on mothers in general, and especially Black mothers, with pregnancy associated death ratios countrywide and in Nevada is yet another example of structural and interpersonal racism that Black mothers and families in general face on the daily. So I'm here and I try to show up and put in this work on behalf of all of my families that I get the opportunity to work with, to bring attention and take action in improving Black maternal health.
Thank you so much, Jordan, for sharing that with us. If you can share one, you mentioned postpartum preparedness. So if you can share with us one thing about postpartum preparedness that you provide to your clients.
Yeah, so I provide resources, all resources from lactation consultant to pelvic floor therapist, obviously to postpartum doula, other postpartum doulas, parenting classes, anything you can think of that a parent might need, we have resources on, and all of my clients receive that. They receive books that they could read to prep for everything. It's really about your knowledge and knowing what's coming. So.
Thank you so much, Jordan, for sharing. And Sen earlier, I love bringing everyone together like this for this very reason. So next up, we have Brittany Lentz. Brittany lives in Las Vegas, lives here in Las Vegas with her husband and her 2 boys. Brittany has her bachelor's degree in maternal child health with an emphasis in human lactation and social justice. Brittany received the designation of International Board Certified Lactation Consultant in 2017. She's an advanced lactation consultant as of 2016 and certified lactation consultant in 2014. Brittany has worked as the breastfeeding coordinator for the Intertribal Council of Nevada WIC program since 2014, serving both tribal and local communities throughout the state since 2014. Brittany also serves as the president of the Southern Nevada Breastfeeding Coalition and as a founding board member of Kijiji Sisterhood, a nonprofit aimed at improving birth outcomes and breastfeeding rates in women of color.
Thank you so much for having me. I'm excited to be here today, and thank you guys for all of the hard work putting this together. Like many of you, I got into this field because of my personal struggles with breastfeeding, and I saw a lot of disparities. I saw disparities in the way that I was treated as a Black breastfeeding mother, and just the lack of diversity in the field of lactation. It was something that I was really passionate about. There are less than 2% of Black lactation consultants in the nation, and we only have 83 IBCLCs in the entire state. So it's something that I'm very passionate about, and I'm just glad to be here.
Thank you so much, Brittany. I agree with you. And preparedness, and a huge part of advocacy has to do with breastfeeding and those post actions. My question for you specifically is, what do you feel can be done to elevate the role that doulas and lactation consultants play in maternal health as it relates to advocacy here in Nevada?
So we know that there are lower breastfeeding rates in Black mothers. A lot of times we hear this discussion about, why aren't Black families breastfeeding? And really we should be asking is why we don't support them to breastfeed. I think that it's really important that we increase diversity in the field. We see a lot of systemic racism in the hospital system, implicit bias with lactation professionals, And a lot of times the families that we work with just don't feel heard. You know, they tell their providers that I'm a breastfeeding mother and their child's given formula without a medical reason. So really a lot of the work that we really can do is to prepare the families that we work with to advocate on their behalf. So it's really important that we let them know what their rights are, preparing them for the hospital experience, where the resources are in the community, really so that they can feel confident in their decisions. It's also supporting their goals. A lot of the families that we serve within WIC, our mothers are going back to work at 1 to 2 weeks postpartum. So we really don't give them that opportunity to establish their milk supply and do those things. So as lactation professionals and doulas, you know, it's learning what the laws are. What are some policies and things that we can do to support the families that we serve? I've also advocated on behalf of contacting, you know, my clients' employers and letting them know what their rights are. So just making sure that we are aware of the policies and the community resources so that we can get our clients to the right people, whether it's postpartum support with therapy, a pediatric dentist for oral assessments. And I know that we've seen a lot of, right now we're dealing with a lot of issues with formula shortages. So making sure that our families are informed about their choices and that we're giving them the opportunity to succeed is really what we can be doing.
Yeah, absolutely. I just love everything that you just said. I didn't even know that you guys were, you know, able to contact employers or whatever on behalf of. So that's incredibly important. Thank you for sharing that, Brittany. We really appreciate it. And last but certainly not least, we do have another panelist here with us today, Aisha Fanning. Aisha is a certified postpartum and infant care doula and a certified labor doula. She trains doulas as a certified doula trainer with Pro Doula. She is Pro Doula certified infant feeding specialist, as well as a certified lactation education counselor through the University of San Diego. Aisha has been a child passenger safety technician since 2015 and a child passenger safety technician instructor since 2019. As an avid community volunteer and leader, Aisha consistently serves as a board member for the Southern Nevada Breastfeeding Coalition, Safe Kids, Clark County, Kijiji Sisterhood, Girl Scouts of Southern Nevada, and Lee Antonello Elementary School PTA and SOT.
Hi. Thank you so much for that wonderful introduction. And I'm thrilled to be here today to have this discussion with everyone on the panel and working to improve Black maternal health. This passion for me started in 2011 after having my third child here in Nevada. And I saw that many of my peers and the people that I called friends in my little village weren't having the same births that I had experienced, and saw that, okay, what one's experience isn't for everyone, and it's not the same. And so why is there that gap? And as a mom of 4 now, knowing that, you know, Black women are known to die in childbirth 1 in 4 of their counterparts. So like that statistic always gets me because technically I should not be here, and many of my other peers. So finding ways to collaborate. It's disheartening how America is kind of failing Black mothers, but it's also so reviving that these communities exist and these panels and these discussions are happening more on the forefront to help improve maternal health for Black mothers. So collaborating within the communities is one way to really combat and close that gap of this disparity. So how do we collaborate with our communities? Well, reaching out to the resources that are already in place and implemented, the WIC communities, the community centers that frequent and offer these resources and support groups, and their healthcare, the Medicaid system. There's so many resources that I feel like our community does not realize that are out there with their own Medicaid and health insurance as well. Also, thinking outside of the box. Look at the schools. There's always pregnant moms at the schools that don't know their rights, their resources, the education. It's all about education. So building up support groups, building community classes that are free and affordable through the hospital systems, right? They've got the space, they've got the resources to open up those doors so that we can step in and teach our community in the peer aspect of that as well. As a small business owner myself, as a women-owned, minority-owned business, I know that struggle of trying to make those big impacts, but it just takes one step at a time, and just knocking on those doors to say, hey, listen, I want to make an impact, and I want you to help me make that change and that impact as well.
For sure. Definitely the grassroots outreach that you touched on is incredibly important. And I agree with you about diversifying the field and just focusing on that collaborative work and being creative, right? I wanted to ask you, and you kind of already were touching on this, but what would be most helpful in collaborating with others, and what does that look like to you?
Yeah, I want to say that the answer is so diverse for everybody, right? We all have our strengths, and we all won't touch the same communities and make the same impact, which is why we've got the big speakers like, you know, Martin Luther King Jr. and Malcolm X, but we also have those quiet fighters as well, like Rosa Parks and Sigourney, you know what I mean? So we all can make the step. Our counterparts of other cultures advocating with us and for us, and not taking our voice away, but saying, yes, I'm seeing this going on. I have a space for you at my table. Come talk to my group, come talk to my office, come talk to this big panel that I could give you a seat to, and listening, not speaking for us, but allowing us to speak for ourselves. And to me, that's advocacy and that's empowerment. And to me, empowerment is bigger than like advocacy, because I don't want you to take my voice and speak for me, but hey, I want you to let me have that microphone.
Wow, this is amazing. Thank you so much to all of our panelists. You've all provided, some really very interesting and powerful insight. I'm confident that we're moving in the right direction towards some real solutions to improving Black maternal health. We are at the Q&A portion of the roundtable. So if everyone or folks have questions, please put that in the chat. And then we'll move on with Tiara.
I'm sorry, 2 years in and I'm still don't know when to unmute. As Rikki said, we do have questions in the chat and we'll address them in a second, but I know Dominique wanted to kick it off for us.
Yes, so I wanted to ask all of the panelists, as I spotlight you all, if how the pandemic has possibly impacted your work with your clients and things of that nature. How has it changed the game for you? And anyone can respond.
So it's changed quite a bit. Originally, we were providing virtual services, but some things just couldn't be done. Oral assessments, sometimes moms really need that hands-on support. The other thing that we saw was really a shift in more people wanting access to breastfeeding support. With the supply chain issues, there has been just a major formula recall, and my phone is ringing off the hook for families wanting to relactate. So I think that, just like we saw with Hurricane Katrina and Harvey, that, not having access to foods for their infants, like it really scared people. And they really had some of these families had their choice taken away from them early on. And so it was really this movement. A lot of us volunteered to moderate relactation groups and induce lactation in these families. So we really, we wanted to give the power back to these families so that they could feed their babies and have that opportunity and not feel that stress when, like the families I support, they can't afford to stockpile. And so when you go and you see that the formula shelves are empty, what are you going to do? How are you going to feed your baby? So I feel like we've been in lactation working around the clock to really just help support these families.
Have you all had the same experiences as well as
I feel like for doulas, like the shift of COVID, like hospitals were like, oh, you can't come into the hospital with your client anymore. Only one support person. And that, like, so having clients, you have to teach the partner how to do the things and help empower them to feel confident to provide that support. And then also, like, what do you do for the people that don't have someone? What do you do postpartum for the people that the only people that live in Nevada with them is their partner and they have no one else? Like, it was a lot of like kind of reconnecting people to like look around you and create a village. Like, look around you and figure out who can you connect with, who can you invite over, who's willing to help you fold your laundry. Like, find your people. And even if you're like, I'm not fully comfortable, like start bonding with them, because you don't know and you don't have the like ease of just being like, let me just call someone, let me just hire someone. Like, people were losing jobs. It created like a whole barrier around having support in the most vital time of life.
And I think related to sort of what you're talking about of, with emotional support, we have a question in the chat where someone is asking, thank you so much for this information. After listening to you all speak, I realized that I did not have full support as a mother who started out breastfeeding. I thought I thought what I was going through was normal in the hospital. So the question is, may you please explain the role of a doula and how do mothers find a doula? And that doesn't have to necessarily be you that answers, it could be anyone. You can answer if you want.
Okay, can you repeat it?
No, no stress. So may you please explain the role of a doula and how do mothers find a doula?
Oh, I love this. Okay, so the role of a doula is to provide emotional, informational, and physical support. And that is throughout the 9 months, not just labor, but if you hire them and you're 9 weeks pregnant, the person is going to be there with you until you have the baby. And 6 weeks after, you can still call them. They're still supportive for you for that whole time. And it's like everyone, we're all different, right? Like how I doula is different from Jordan, different from Rikki, different from Tiara. But we all are like, do you need resources? Let us know. Do you need someone to hold your hand? Let us know. Let me rub your back. Like, I'm very much a get in where I fit in type of doula. Where do you need me? And then finding doulas, you can look on Facebook. Like for us, we have a lot of people that ask in Facebook groups and we will refer to each other. Google searching. There's a website called Doula Match. There's Black Birth Workers Directory. Sister Midwife has a directory for doulas. This is not like just specifically Vegas or Nevada. It's national. Yeah, there's a lot. There's like 2 doula groups on Facebook that's like find a doula, and it's national. So there's ways to find them, and then you just you pick one, and then you ask like, well, who's your doula friends? Can I interview with them too? And then you find your person.
Thank you.
You're welcome.
Dominique, if I could piggyback on what Sin was saying, because I love that she was saying, I just get in where I fit in. And I think that's what I loved when I was exploring, becoming a doula and just exploring what it is. I think I just wanted to add, like, it's so important for families to know that we're not here to relegate your partner or your support people or whoever to third wheel status. Just as Sin was saying, we're here for the mom, because everyone in that process is focused on the baby and the health of the baby. And there's so many medical professionals around, which is awesome. But we're simply there to enhance and coach them through the experience and help everybody relax, not being a non-medical person. So I just wanted to add that.
Perfect. We have a question from Sheila James that says, are there efforts in Nevada to implement policies in hospitals, even those that are baby friendly, that are responsive to birthing people and their families? So it seems like that's the first question. There's another one.
Yeah, so we only have 3 baby-friendly hospitals in Nevada. The baby-friendly hospital initiative is really important because it helps overcome some of those disparities because there's a standardization of care. So with the baby-friendly hospital initiative, there are policies in place so that every birthing person in that hospital is getting the same care and the same type of breastfeeding and lactation support. So you see higher breastfeeding rates in states like California. It's a very expensive process to become baby friendly. California received a very large grant, and all of their birthing hospitals have to be baby friendly. So if you know that every hospital that you go to is, you're going to receive that same standardization of care. Everybody's been trained from the people who, do your intake. Everyone has had some sort of breastfeeding support. So the baby-friendly hospital initiative really does address those disparities we see in lactation.
I'd like to add, even though that we do have those types of hospitals that are baby friendly, assuming that they're going to do those things as well is not, it just doesn't always happen. I just went to a birth with, they didn't do any of that, but they are a baby friendly hospital. So having a doula and also knowing your rights and what you want to do and knowing how to advocate for yourself is really important, even in those hospitals. But I agree that it's amazing that we do have those hospitals and they do get that training. It's just, they just don't always apply those trainings, unfortunately.
And the second question is, the other thing that comes to mind is asking if anyone has used the Earth app, the one that's Earth minus the B, or Birth minus the B, to rate their birthing experiences.
So I downloaded the app like last year and I check it like every week or every 2 weeks. There's actually not a lot of reviews for Nevada. And I wish that people would review it more. And I kind of thought about this where I'm like, I should probably like tell my clients like, hey, download this and review it, because we need reviews. Like the community needs those reviews. We need to know what OBs or practices are not actually great, or what experience you had at what hospital. Like, granted, shift changes, you never know who's going to be there at the hospital, but it's good to know that. So, yeah.
Yeah, and the Earth app is relatively new, I believe in the last few years or so. There's also another resource called Birth Monopoly, and they've been doing work a really long time, and they have essentially a map of folks who have complaints. I really do like the Earth app because it lets you narrow it down, but Birth Monopoly is also another one that's available.
So a question here is, what are the requirements to become a doula in Nevada?
Mm-hmm.
I'll take that one. So currently, doula profession is not regulated or licensed. So you can take a training or not, but and work as a doula. So there's not really any regulation or legislation. There's no rules in the higher sense. However, many of us on this board have taken the training and the proper requirements and certification to be able to provide the best support to our communities as possible, because oftentimes without the correct, I don't want to say necessarily correct, but we can often do more harm than help if we only use our own experiences to go off of to help and support someone else, because our own trauma or our own biases come into play. So yeah, so finding the proper training channel that speaks to you is the first step. And there's many, many great trainings out there.
Yeah, I was going to add, like Aisha was saying, there's so many options. And I know when I started out, I was like a bit overwhelmed. I would start with one and then stop. And then, my advice would be just to research them all, check out beyond their training, like what are they doing for the community that you're trying to serve, because that'll be the best fit for you.
So the next question, I think it's building off of maybe what Brittany was saying before about breastfeeding rates. So the question is, did I hear correctly that there is a low rate of breastfeeding among Black women? And if so, could this be a big contributor to the high rate of late stage breast cancer deaths among Black women? This may be unrelated, but I know that I have heard there is an increased risk of breast cancer for those who do not breastfeed.
It's definitely one piece of the puzzle. You know, it's that systemic racism in the system. There are so many things, late diagnosis, access to mammograms, so many things, but we know that breastfeeding does reduce rates of breast, ovarian cancer, type 2 diabetes, and a lot of conditions that Black women are disproportionately affected by. So we do know that breastfeeding is important for maternal health, but also for infant health, as you know, we see that Black infants are 2 times more likely to die than white infants. But yes, breastfeeding rates are low, but we need to, you know, that's like part of the piece. But, you know, formula marketing companies aggressively target zip codes where Black women live, Black families live. And so, like I said, it's one piece of it, but yes, definitely improving breastfeeding rates in Black women could help reduce breast cancer morbidity.
Thank you. And where can I become a lactation consultant to further assist my clients if need be?
So there's a lot of different options. Most of us start with a course. You can start with like the certified lactation educator course, the certified lactation counselor course. I got, you know, in order to become an IBCLC, it's a huge jump. It's a lot of work. And a lot of people aren't really helpful in helping you get into that field, which is why it's my passion to kind of increase diversity. But starting out with attending a coalition meeting, we offer scholarships for women of color to take a lot of these trainings because it is a huge financial burden. So connecting with your coalition, making sure that you're getting involved and looking at scholarships to really help that burden of the cost. And then also a mentor. I have lots of calls and offer mentorship for anybody who's wanting to get in the field.
I have a question. Brittany, can you explain the difference between a lactation educator and a lactation consultant?
Yes, so there's a very different scope of practice. So when you look at certified lactation educators and certified lactation counselors, these are like the, you know, the boots on the ground. These are the families. They're really working with the families to provide the education and basic breastfeeding support. So that is really the go-to peer counselors, peer-to-peer support, breastfeeding classes, things like that. The difference is when you get to the IBCLC portion is that now you are in the role of a healthcare provider. So our scope of practice is a lot different, where we're doing oral assessments, we're working with physicians with care plans, supplementation, all kinds of infant feeding. We may be working with tools and devices like nipple shields, supplemental nursing systems, inducing lactation for our LGBTQ plus community, adoptive parents who are wanting to induce lactation. So it's when you really get to that point where you're needing more of the medical side of things. Kiddos with cleft palate. So any type of medical conditions, special needs, that's when you kind of want to go to that expert level. But it's really the CLEs and the CLCs and the peer supporters that are really helping affect those breastfeeding rates. And then once it moves out of their scope of practice and they've helped all they could, then they kind of pass it off to us to be that medical piece to kind of coordinate with the physicians.
Thank you. Let's see. So I know there was a comment. Nevada Medicaid is in the process of covering doulas as a benefit. Will this impact access and improve outcomes? And I'm not sure, they didn't say exactly what outcomes. I'm maybe referring to breastfeeding, I'm not sure. But if they could clarify, that'd be great.
Yeah, I'll go with it as even birth outcomes, because it's known that having a labor doula at your birth does decrease in, it improves birth outcomes by 25%, builds a breastfeeding rate success as well as 60%. So overall, that's maybe some impacts and outcomes that they're talking about. But yes, Nevada has passed a bill that insurances overall and Medicaid will be able to reimburse doulas, which is fantastic. Rikki and myself are on the board for that certification. So we are hoping for an April 1st deadline for that is what they're asking for us, of the board. And then the next question under that is saying, is there any organizations or associations for doulas? So I'm going to add those both in. You will have to be trained and certified to be able to get reimbursed by Medicaid for this, and there is a set price. The great thing is that it's happening. You know, doulas are being known to help support and build better outcomes in birth. So it's really important. And then there's many organizations like Tiara said as well for doulas. You could just Google and you will find a lot, and just find one that kind of meets your kind of point of view and how you'd like to support the community. Go ahead, Rikki, go ahead.
Yeah, one great organization that I absolutely love is called, of course, I forgot my thought. But it's National Black Doulas Association. So if you're specifically looking for a Black doula, they have a database, but they also have a membership. So if you're a Black doula, you can join their membership, and they offer, you know, continuing education, access to, you know, their platform. So that's also good.
Sorry, I wanted to add, because it's a question of access and like, how do you access a doula? You can always, 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 and I highly recommend it, ask a doula if they have sliding scale or if they will barter. Because a lot of doulas, especially doulas of color, will. Because we are, like, if you heard every single one of us answer, all of our starting points was because of the experience that we had, right? Because of the lack of support that we had. So we understand what you're trying to avoid, and we want to also help that. Like, that's why we're here today, to change outcomes for people. So most likely those doulas will have something in place to help you offset the cost, whether it is like fully, like partially off, or just sliding scale, or breaking down the payments, whatever it is, it's specific to them. But there's always a way to find a doula that will do it.
So we have a question from it is a pharmacist. Yes, I do personalized medication management for pregnant women with a specialty in hyperemesis gravidarum. I can never pronounce it, but it's basically extreme morning sickness. I'm a PharmD and certified doula. How can I support our community?
I would say connect with us. Like, send me a message, give me your number. Just because if you provide that, we all have different clients that have HG, and we need really good people that can help them. That isn't just like, maybe they're not at the step of going to the hospital and getting a PICC line or whatever they need. Like, maybe they're not there. Maybe it's a in-between step. And we can always use more resources like that, especially in our community.
And to add to that, I think the overall theme and a little bit of what Brittany was talking about comes down to listening to Black mothers, listening to Black folks is the bottom line. We see, you know, if you look at Beyonce and all of them, even they weren't listened to, you know, so it comes down to listening, catching these things. So specifically, HG is a really big uphill battle because it's looked at as just morning sickness, but it's so much more than that. It can actually be life-threatening, which I'm sure you know as the HG pharmacist. So giving us the tools to help our clients, because again, going back to access, you know, not everyone, you know, can afford, you know, the hydration that you need for access to people to come to your home to help you service, you know, to live. And so a lot of women are dismissed when they have HG. A lot of birthing folks are dismissed, specifically with HG. Out of really all the other diseases, there's no research. So if you can, you know, give us the resources that we need to give to clients, especially those who, you know, don't have the means to switch doctors and get someone to be on their side when it comes to this.
And so I do want to spend just at least ask one question related to the postpartum experience. So how do you feel clients are, or adequate, do you feel that they're adequately prepared to, for their postpartum experience, right? Going home, sort of knowing signs of when to maybe contact the doctor, like with blood pressure, high blood pressure, or anything like that. Do you feel that your clients are adequately prepared?
Well, I do feel like my clients are adequately prepared. I try my best to prepare my clients for those moments. But a lot of times I step in postpartum, and they had no idea what was coming. They had no idea what to prep for. They had the nursery and everything ready to go, everything ready for newborn, but they didn't even explore the options for themselves or have resources available or know what resources to have available to them. And as far as what to look out for after, again, so, when I step in postpartum, a lot of clients don't know what to look for, like high blood pressure or what postpartum depression looks like, what the symptoms of postpartum anxiety or postpartum OCD or any of these things are. They had no idea what they were, what to look for. They didn't know that their partners could also go through postpartum depression and anxiety and all this similar things that they go through. So no, I mean, I find that a lot of my postpartum clients don't, and that's why I feel like that's why they got impact. They had that impact because they had no idea what was coming. They had no idea what to prep for. So it was literally like somebody is just throwing rocks at them and they're like, what is going on? And again, I think preparing for this, and even though we don't want to, and like a lot of times when we were going, well, for me, when I was going through postpartum depression, I didn't want to do anything. I was just like, leave me alone, don't talk to me, don't touch me, I don't want to go anywhere. But those things are really important. Nutrition, emphasizing on, you know, nutrition in our postpartum time, and then movement is also so important, and we don't, you know, a lot of times we're not prepped for that. So I hope that I answered your question.
You did. Did anybody else want to say anything?
My thing is, I also like to emphasize that their partners can have postpartum depression and postpartum anxiety, and how that impacts the family transitioning into parenthood. I think, and a lot of times I get partners that just look at me like, no, I'm good. And I'm like, no, please, hello. How are you feeling? Because we need to know this, because you are part of the team now, right? And really just echoing everything that Jordan says. A lot of times when I have people that are like, I need postpartum support, I'm tagging Jordan. So I agree with everything that she said.
Thank you. And with that will wrap up our question and answer period, and I'll turn it over to Tina for some closing remarks.
Well, I just want to say this has been so illuminating, and to thank everyone who's been a part of this conversation. I want to take a step back. I think we had a bit of technical difficulty at the beginning of our session, and we want to make sure that we share that image that I described, because it is beyond powerful, and not everybody's aware of the work of Mr. eBay. But Dominique, if you can throw that image up, and the more we can identify and amplify examples such as this, I think it does work towards solutions that we're seeking, elevating the conversation. And so if we can, yes, this is, and it may seem very, why are we talking about this right now? Why are we sharing this image? And it's probably because you don't realize it, but very rarely are you BIPOC moms, BIPOC equity, birth equity workers, are you featured in the textbooks and in the periodicals for the profession. And so Mr. Chidi eBay took it upon himself as one of many burgeoning illustrators to start requiring and requesting and providing images that show people with different skin tones in medical literature. And this one in particular went viral. He's done it in other categories for other illnesses and other medical scenarios, but this one in particular, featuring a Black fetus, has gone viral. And I just wanted to make sure that, again, we took a moment to share this imagery because of its power. So thank you, Dominique. Again, just extending gratitude. We're wrapping up, and we just wanted to say that this midday roundtable was always meant to just serve as a way to gauge interest in this topic. And we are so pleased by the robust response from the community. The questions that were being posed, we've noted all of them. Those conversations and the people sharing information, we will be sure to package that and share that with you. But there was also even conversation about recent legislative actions that we want to make sure this particular body is aware of. And so an example of that legislative action is Assembly Bill 119. This was passed last legislative session, and it is tasking our state's Maternal Mortality Review Committee to review instances and trends in severe maternal mortality and morbidity in the state, and to identify and review disparities in the instance of this particular phenomenon. Well, NOMHE has a role in that. We've been identified in that bill, our advisory committee in particular, to help with that production of that reporting. And as a result of that, we know that we're going to be looking for members of this community to come on board and help NOMHE so that we can influence and be heard by virtue of the resulting reporting from Assembly Bill 119. Well, we're going to take a few minutes also as we wrap up to be able to collect some of your impressions about today's roundtable. And we're going to do this by presenting a quick poll. We call it a flash poll. And I think, Dominique, if we can bring up the 3 questions on the screen, we're just going to ask that you take a look at these questions. I'll read them to you. And while I'm reading them to you, you can be taking the poll. Question number 1 is, having participated in this particular forum and this roundtable, are you now interested in learning more about the Office of Minority Health and the work of that advisory committee that supports my office? That's a yes or no question, and please go ahead and answer it. And are you interested in forming a Nevada birth worker collaborative or an alliance that is a resource that brings together all the referrals and information that we've been hearing and sharing today? And then also, of today's conversation, what did you most enjoy, or what did you find most impactful for you? Was it the conversations about prenatal care, postpartum care, advocacy, or collaborative opportunities? And there you can pick all that apply. So let's give that a few seconds, Dominique, so we can actually see what the results are as people take this poll. And again, having thought about this particular opportunity to bring people together, we just want to make sure that everyone understands that the purpose for this dialogue is because we believe having maternal health issues at the forefront of dialogue, it really does benefit all of society, and that we're going to be able to determine the health of our country by looking at the health of our mothers. So are we able to pull any results up from the poll, Dominique? Well, if we're not able to, we still want to end.
We still have people, I was gonna say, we still have people taking it.
Ah, okay.
Yeah.
That's great. That's great.
It looks like we're about done, so I will just end the poll now.
And
Great. Do
really,
you see the results?
yeah, we can. Okay. And just in response to some of those poll questions and where it really overlays with the slide you see now, if we could go to the final slide. There we are. So we see that there's some interest in working with the Office of Minority Health and even perhaps in joining our advisory committee. And if that is where your interests are somewhat kind of are landing, please feel free to either use that QR code or take down my email address and let me know if you'd like more information about how to either attend a meeting or becoming part of that committee, because the committee will have a focused role now on this topic. And then that second poll question asks about your interest in just creating some type of a collaborative to talk about this topic. And the best individuals to reach out to, as you can see there, would be Rikki and Tiara. And their information is also provided for your follow-up. And then that last question on the poll where we asked about which of these topics are of interest to you. It was pretty much an even split. We had 73% people talking about collaborative efforts are important. And then we saw 60%, 58%, and 67% asking for information across prenatal topics and postpartum topics and advocacy. And those last two QR codes is where you can get that information, attending a meeting of the Maternal Child and Health Advisory Board, or even just visiting their website. There's so much information and reports that you can find there, either at the website or through the dashboard. And so, as I said, lastly, we're going to be culling all the information from the chat box and making sure we share it with those who registered for this call. And we don't have anything else to share with you. This was meant to be an hour, and we are at the hour mark. And we want to be very, very respectful of your time and just thank you to my moderators, to my guest speakers, to my staff, to those who took time out your day. I so appreciate you, and we are just so happy. And this will not be the last time I think we have these conversations based on the interest that was shown. So thank you so much. We enjoyed you, and we hope you have a wonderful weekend. We're going to ask that our team, our moderators and speakers kind of hang tight, and we'll have a few remarks at the end. Hi, Tiffany.
Dominique, are we copying the chat? Is that right?
Right.
Yeah, I'm trying to do like 30 things at one time. So yeah, I'm trying to.
You're good. You're good. I was like copying it.
I'm also copying Pat in case.
Good,
Okay.
because I'm also getting personal messages too. So I'm like,
Yeah, it's always hard because you got people coming at you from cell phones and direct messages and emails. But Carlos, if you can just copy everything in the chat just to be certain.
I think that
Absolutely.
you can save the transcript of the chat. So you
and we
can
do
just
have it. It does
into
save.
it.
It does. You know what? It does. I forgot.
Yeah.
'Cause it's a sent a recording.
That way you don't have to be like, ah.
I'm always
But
just
my
nervous
direct
about it
message-
though.
My direct messages don't save though. So I do.
Right, direct messages won't save. And that's what I also was trying to capture. I've got a lot of direct messages also. I'm trying to.
Just for numbers, we had a maximum amount of 80 people participating.
Sounds good. And the thing is I think some people probably thought that the event might have been like they were registering as it was happening, and some of them didn't even show up. So I think they probably thought the event was like, say, next week, for example, because I've done that before, where I didn't really pay attention. And I was like, oh, this sounds great. But
I'll come back to it later when really later is now.
Yeah. So.
But that was a very, very robust turnout. They're using that word again, but absolutely. So I just want to, I think.
Wait,
I don't know.
I think there's still some people in the line.
Yeah, sometimes I think they just didn't connect out. Can you take them out of the meeting?
Oh yeah, I can.
Okay.
I think it's just us now. Okay. Yeah.
Yeah.
Wait, did I kick someone out by accident? Uh-oh. Oh no, you guys are spotlighted. That's why. Sorry. Okay.
Rikki's not in here anymore.
Oh, I might have kicked out Rikki. My bad.
Oh, oh,
Let me email her. I mean, not email, text her.
oops. Well, I just wanted to just give a really, really robust and like excited thank you. You all are rock stars. And I know, Carlos, we were making you crazy because we weren't following everything to the T, but it's like a wedding. Nobody knows what was supposed to happen, right? They don't know that we didn't follow everything, but it worked out great. And even the questions were more organic. The questions were awesome. I mean, you know, you got a plan just in case, you never know. But this was such a great experience. We are going to debrief with the moderators at some point next week. But I think that you all should expect to get a lot of interest as a result of this. So, you know, the reward for good work sometimes is more work. But we're going to make some decisions about some next steps and some actions that can come out of this. But for right now, I just wanted to say thank you. I don't have anything else to ask. I know we've been putting a lot on our moderators and the guest speakers. You guys came through. You were so amazing. So unless, Dominique, there's anything else we need to say. I think we got somebody.
Yeah, Tina, you guys were
Rikki.
great and made it super easy. And I know Rikki probably reached out personally. Like I said, I lean on her for the
I think
people in the
she's trying to
community.
join.
She's trying to. I
Oh,
don't
she's
see
trying to
her, y'all.
rejoin.
Yeah.
Okay.
Oh, okay.
Let's just make sure we take a collective sigh. That's always nice. The headache and the anxiety about.
I thought you guys made it really easy. Yeah, no,
Yes.
I mean, we've been Zooming for what, 2 years now? And sometimes it's
That's what we want to hear.
a
That's
little
what we wanna
crazy and
hear.
then sometimes it's easy.
What's funny, towards the closing remarks, I lost my talking points. It just disappeared. So I was like hustling, trying to find them. So,
Yeah.
you
It's
know,
crazy. There's still people trying to join in. I guess they didn't
No,
get.
it's Rikki. It's just Rikki.
no, that's just Rikki.
Tiffany. Someone know Tiffany?
Oh,
Oh,
Tiffany
I-
Tyler?
That we
No,
just
I put-
let out. I wonder why.
Yeah, I let her out. I put her in the waiting room. I don't think I can actually like.
I'll
make
text her.
Yeah, it's definitely
Does she need to
over.
be in?
No.
She was in.
Oh, you know
She
what? There's a button to remove. I didn't see remove, so I could have just removed her instead of putting her. in.
Yeah.
Oh, okay. Yeah, I'll text her and say, Dr. Tiffany, it's over.
Yeah, but thank you for showing. We appreciate it. So, but Rikki, again, you kind of, we kicked you off prematurely. We're just saying thank
I'm
you.
sorry.
And that, you know, we're going to cull the content in the chat and look for logical next steps and things like that and actions to be taken. But I absolutely anticipate, you know, the work of yourself and some of our other subject matter experts. I expect that you're going to be getting some contacts and some people reaching out as a result of this. I even saw one person who operates the Mama van.
Yes,
asking,
I saw that.
Yeah, I thought that was pretty, I wasn't expecting that, you know.
Mhm. I saw someone from Senator Rosen's office, a couple of people. Yeah.
So as I said, there's already expectations for interviews. And we're holding the morning of next week, the morning of the 23rd,